Okay, I think we're back up. We had a little glitch there. Everybody can hear?
I can hear you, Sean. Harry.
Okay. Well, maybe just allow one more minute. We had more participants, and I think looks like they're signing back in, so we'll give it just another minute here.
Okay.
Can you hear us here in the chambers?
We can hear.
Perfect. All right, you guys are good.
Okay, so I think at this point we've got a quorum again, so we'll go ahead and call the meeting to order. I hope everyone has had a chance to review the agenda. We may rearrange the agenda just slightly, but we'll still get to everything. So first of all, we'll call the meeting to order. Before we do introductions, I just have an announcement to make regarding Zoom. So there is the equivalent electronically of raising your hand, especially when we get to the public comments section. So for those who are actually using the Zoom app on your computer, there's a button at the bottom you can hit to raise your hand. If you're listening on a phone, the command is *9 on your keypad, and that can raise your hand as well, and you'll be acknowledged and you can make your comment. When it does come time for public comment, we're going to try to get to the folks who are live in the chamber, and then we'll get to the online people, but everybody will have a chance to speak that wants to. So let's go ahead and make introductions first. I'll go ahead and start. Sean McRoberts, Emergency Physicians Representative.
Harry Robbins, Citizens Rep, Central.
John Anthony, Monterey County Parks Department and RMA.
Joe Cafaro with the Hospital Council, brand new.
Tina Nieto with Law Enforcement.
Roxanne Seversad, EMS Agency.
Tino from AMR Ambulance Operations.
Okay, well, we'll go ahead and move on with the agenda. But before we move on to the next item, though, I'm going to turn the floor, so to speak, over to Harry Robbins to read a motion that I think is very appropriate.
Yes, Chair, I'd like to make a motion under the good of the order, which is towards the end. I think this is more appropriate up front, so I beg your indulgence in this regard. My motion is basically this: I move that the Emergency Medical Care Committee commend the members of the county's emergency medical care system for their diligence, dedication, and consistent professional performance of duty during the ongoing response to the coronavirus pandemic. Recommend that the County Board of Supervisors do likewise. This commendation is intended to include all involved members of the Health Department, the Emergency Medical Services Agency, the Office of Emergency Services, and the Emergency Operations Center staff, and our 4 hospitals and their emergency room staffs and treating physicians, and the first responders of the ambulance, fire, and law enforcement services.
Okay, so we'll make a motion. All those in favor of approving? Aye.
Aye.
All right, to intervene.
Aye.
Can they?
Aye.
Aye.
And those opposed?
Aye.
Okay. So hearing none, we will forward the motion on to the Board of Supervisors.
I was going to say public comment on that motion, but I don't. Can you guys hear me?
We can hear you.
Oh, okay. Technically, you had to open it up for public comment. It doesn't look like there are going to be any, so.
Okay, if there are any, please go ahead and speak up. Okay, so hearing none, then we'll go ahead.
There is a gentleman in the office, or the, one person wants to make public comment.
Please.
John, are we still online? I've lost my pictures.
I can still see the pictures. I did not hear the comment.
Yeah, I'm not getting pictures of everyone for some reason. I'm going to back out and try again here.
Okay. Maybe Teresa or someone who's present in the chamber. Did the person making their comment, were they able to?
Sir, actually, it was just public comment for that motion item.
Right, right. Yep.
And the RFP there'll be opportunity to comment on that when the RFP comes up.
We're having a hard time hearing you in the back. Are your mics working?
Can you hear me? My microphone's on right now.
So I can hear you. I did not hear the comment, though.
The comment was on the RFP, and I just instructed the gentleman that there will be opportunity for public comment on the RFP. This was just public comment on the motion that Mr. Robbins brought.
Right, okay, good. So we should clarify, we're going to set a large chunk of time aside at the end for the RFP. That's why the meeting has been extended by an hour. So there will be ample time for anyone who wants to make a public comment. But if we are in favor of approving Harry's motion, we'll go ahead and approve it to forward to the Board of Supervisors, and we'll move on with the agenda. So item number 2 is technically public comment, and we'll ask that this be public comment not specifically addressing the RFP, which, as I said, we'll get to in a little bit. Is there public comment for anything else? Okay, so it doesn't sound like there are. We'll move on to number 3, approval of the past EMCC meeting.
John, I move approval of the meetings minutes for March 11th.
Tina Nieto, I second that motion.
All right, all those in favor?
Aye.
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 And those opposed? Okay, hearing none. So we'll go on to reports. So first up is the Medical Advisory Committee. Anybody have a chance to review?
Yes.
Go ahead and speak up if you have any questions or concerns. So this is regarding the last time around in March. Reports from the Ops Committee. And then Teresa, anything else to add from EMS agency at this point?
Thank you. I wanted to, can you hear me now?
Yes.
In the back? Okay, thank you. We just wanted to announce that Jared is no longer with the EMS agency, and Troy Me will be leaving at the end of the month. We are in the process of the recruitment is going on right now. We have brought 2 EMS analysts on a temporary basis to help us continue the operations until the recruitments are done.
Okay. Okay, so that's it for item 4 reports. We're actually going to move item 7, new business, to the next spot on the agenda. So that's election of EMCC officers. So this is something that would have happened ideally during the May meeting in preparation for this month, but with everything going on with COVID, it was postponed. So Teresa, I will let you maybe talk about this one.
Thank you. Just as the staff report says, the EMS agency recommends that the EMCC members elect a committee chair and a vice chair at this meeting, with the elections being effective September 9 of 2020, that would be our next meeting, and continuing on to June 30th of 2021.
I have a motion.
Okay.
I move that we elect Carla Spencer as our chair with Tino Ariano as our vice chair.
Okay. Any comment or discussion? All right, all those in favor?
Aye.
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 And
I'm
any,
sorry, I didn't hear a second on that motion.
Need me to repeat it?
Tina Nieto, I second the motion made by Harry.
all right, so any opposed? No? Okay. Teresa, do you have anything else to say about the election of new officers?
No, thank you.
Okay. So the next item in new business then, EMCC membership.
Thank you. That's my item. I am very happy to report that we have new members of our committee. To my right, we have Paul Wood, representing city managers, newly appointed. We have Greta Steinbrenner.
Steinbrenner.
Sorry. Representing EMT and paramedics, John Anthony, who's joining us via Zoom. He is the Monterey County Parks Department representative. Then we also have as new appointments Chief Cheryl Goetz. She is from representing as an alternate for BLS Fire. Ben Harvey, he is the alternate for the city managers. We also have Joe Pofaro, the alternate hospital administration representative. And we have a couple of nominations that are going to the Board of Supervisors for approval. One of them is Sam Ballesteri. He will be an alternate citizen rep. Chief Roger Reinhardt, replacing George Nunez, is going to the Board of Supervisors for approval. And we also, sad to say, that Dr. McRoberts has chosen to step down from the EMCC. We received two nominations, two individuals interested in serving on the committee. That was Dr. Noah Hawthorne and Dr. Nicholas Greenson. The nomination has to be made by the MAC committee. The nomination was just made at the last meeting. In the staff report that you have with your packet has the appointments opposite. The committee nominated Dr. Nicholas Greenson to be the primary representative and Dr. Noah Hawthorne to be the alternate. But as of now, all but one of the members' positions have been filled. Also sad to say, Harold Wolgamat chose to step down after his term ended. We are actively recruiting for a citizen rep to replace Harold. And with that, I want to say that I want to acknowledge and thank both Harold Wolgamat and Dr. McRoberts for the contributions that they have made to the system, to the EMCC. They have been very active, and they have made great contributions to the system.
Just a couple of comments, Sean and Teresa. One, I appreciate the diligence of the agency in filling these vacancies. I also appreciate the efforts put forth by Sean McRoberts and Harold Wolgamat during their tenures. They will both be missed. And one minor correction here: Cheryl Getz's name is Getz, not Goetz. So it's pronounced Getz, German heritage. So go from there. Thank you.
My apologies for my mispronunciation.
I do it all the time.
Okay, so we'll pick up then at item 5 on the agenda, EMS system performance metrics. And that's just to say that we elected, in order to provide more time for discussion of the RFP, to skip that item for this month's meeting, and we'll pick it up again in September. Okay, moving on to old business, we'll start with EMS agency COVID-19 response update from Troy Mead.
Unfortunately, Troy is not with us this morning.
Okay.
He did prepare a staff report, which was attached with your packet, and he summarizes some of the activities that have taken place since March. I have to say that I think that Troy has downplayed the role that he has played during this COVID-19 response. He has been a tremendous asset to the agency in his role as the MOAC, securing PPE for the county. Always very proactive and very engaged with all of our stakeholders. So, the rest of the information is on the staff report. I only want to add that our last survey of the system stakeholders indicates that we don't have any shortages of PE at this time.
Okay. So then moving on to our next item here in the old business is discussion of the RFP. So,
Dr. McRoberts, there's a question?
oh, there is, okay.
Yeah, this is Gary Millay. Can you hear me?
Yes.
Yeah, hi. As the director of the EOC, I just wanted to second Teresa's comment that Troy's report severely downplays his role and importance as the Mohawk in the EOC. We've been activated now for 132 days, and the role the Mohawk plays under the logistics section it cannot be understated how important that is to not only our EMS providers in the operational area, but to the EOC itself. And Troy's done an outstanding job. It's unfortunate that he's moving on to other things, and we are really looking forward to somebody of his competence to replace him. And hopefully there is no lag in the Mohawk in the EOC, because we most likely will be activated for many, many more months.
Yeah.
That's all I had to say. Thank you.
Okay, thank you for your comment.
I have a question.
Please.
Teresa, based on what Gary had just mentioned, you'd mentioned that you were able to bring in two temporary EMS analysts. Do they have some type of EMS background that they'd be able to support the Mohawk with Troy's departure?
No direct experience in terms of Mohawk, but they have translatable, adaptable skills and experience. And since Troy is staying with us until the end of the month, beginning Monday, we're going to do a lot of that cross-training needed so that there is a smoother transition.
Okay. And I just do want to say thank you on this, that I know I can speak for our agency that Troy has been instrumental with helping us during this COVID with PPE and being that conduit and liaison. And we did appreciate all his work. Thank you.
Any other comment? Okay, so Teresa, I think then we'll move on to the RFP. And we'll rely on maybe those in the chamber and then the IT folks who are on the line to kind of help us make sure we acknowledge all the in-person and digital questions.
Thank you. As everybody knows, the RFP was translated into Spanish and has been out for public comment for more than 30 days now. This was to make sure that anyone interested in this RFP had the opportunity to comment on it. The agency, as we promised, we advertised in newspapers, radio, websites, and in social media. In our ongoing effort to be transparent, all public comment received to date has been posted to our website, and we have been notifying interested parties that public comment can be viewed there. Also, in our ongoing effort to be transparent and at the request of this body, the RFP is on today's agenda to give this body the opportunity to discuss and comment on it. To protect the sanctity of the process, the EMS agency will not be able to engage in the discussion or a Q&A about the RFP process itself. However, we want to assure everyone that we are listening and looking and considering all public comment received very, very carefully. While we cannot engage in the discussion or Q&A, we do want to provide some highlights of the changes made to the RFP, and maybe that will provide some context, some of the questions that may be out there. As everyone knows, developing a new ambulance services provider agreement and conducting an RFP are very complex tasks. The EMS agency is asked to be innovative and develop an agreement that can adapt to an EMS system that is changing rapidly, but effecting the change needed may not be so easy. Given the complex geography of Monterey County, one of the challenges is how to get resources quickly to individuals located in remote or difficult to access areas of the county. The EMS agency must work to strike a balance between the scope of services provided to our community and the cost of providing those services. Despite the challenges, the EMS agency takes this responsibility very seriously. In the development of the new draft RFP, the EMS staff applied lessons learned from the 2019 procurement. We reviewed the feedback received during and since the 2019 procurement, surveyed RFPs from other jurisdictions, and communicated with the EMS authority. The information gathered resulted in extensive revisions to the RFP. I will summarize some of those changes. The new RFP is designed to encourage the provider to provide coverage for the EOA so that the closest ambulance is responding from the area of the medical emergency and not taking ambulances from outside of the EOA and leave their primary area uncovered. Having said that, the RFP is still designed to have the closest ambulance respond to a medical emergency. It is important that high acuity, life-threatening calls are responded to immediately. The use of non-contractor ambulances in the peripheral areas is an example of this, as placing an ambulance in a low call volume rural area is not feasible. The use of mutual aid is another example of this. I want to talk a little bit about our maps and the response time compliance. And do you mind putting that up? And hopefully this will bring some context to some of the changes that have been made. So thank you. This is the map that you see in the new RFP. And what we want to tell you about this map is, instead of using the old colors that we use, the red, green, yellow, orange, we decided to use a different terminology, and even that we needed to adjust the terminology so that it applies to our county, because we really don't fit in urban area, but the largest areas of our county have been labeled urban, and to translate that to the old maps, this is a former green area. And we didn't make any changes to response times in those areas. Now, the suburban area that you see now, which is a little bit darker green, this was split into two areas, a yellow and an orange. That is how it is in the current contract. We went back to review records to try to find the logic behind having the two zones. One of the challenges that we experience in the current agreement is that with the 100 call rule used for compliance reporting, it takes at least a couple of months before we have enough calls in yellow to be able to measure compliance. And it takes even longer than that to be able to measure compliance in the orange area. The lightest, I'm sorry, not the lightest green, the medium green, it is what we call a rural area, which is what used to be the red zone. One of the changes that we made here is that in the current agreement, there's no response time requirement. It's just ASAP. We've added a response time requirement, and the changes that we made, we reviewed data dating back years to try to see what is happening now, what is logical, what is reasonable in order to do that. But we feel that in order for us to speak more about equitable service in the county, or just really holding the provider accountable for the entire area, we cannot ignore the rural area that just had an ASAP as expectation. So one of the things that I want to say is that all priorities are potentially divertible to a higher level except priority 1. These are the highest level and they're not divertible. So high acuity, life-threatening emergencies is red lights and sirens, everybody go. And I already mentioned the fact that the more standard definitions of what an urban area is, or suburban or rural, our county doesn't really fit those definitions, but we try to make them work within and giving them context here. Can you switch to the next one? In terms of response times, this table shows a comparison between the response times that we have now. Well, I'm sorry, what we had in 2019. No, it is what we have now in what is being proposed. So you see we have the urban area, which compares to the green area in the current contract, and you can see that they're mirrors of each other. There's no change in the response time. And you can see listed by priority, the priority 1 is a life-threatening emergency response, red lights and sirens, of course. And in terms of first responder response, they determine how they respond to that call. In the suburban area is where you begin to see some changes in those response times, because that's what is now called a suburban area. It is a combination of the yellow and orange zones, for which we could not find the logic behind those. And the issue with that is that the number of calls, the lower volume, the easier it is for a provider to fall below compliance when you're measuring the 90th percentile. And what you see here is that the variance in the response time between the yellow and the orange, ranging from 12 minutes to 16 minutes there. What we did is we combined them, looking at the data that we have, the historic data for these areas. We established a response time that is reasonable, that is achievable. And then for what is currently now the red zone, they just had an ASAP as response expectation. We've added a response time requirement there, and that is also based on data. We have looked at the data currently of how long it's taking to get to the remote areas of the county, and we established this response time. Again, you can see that for some of the lower priorities, there's no red lights and sirens, but definitely for priorities 1 and 2, those are always red lights and sirens. The unit is going to get dispatched right away because we want those life-threatening calls to get help right away. What we also did is we tried to do a comparison with other jurisdictions. Now, let me first start by saying that this is not an apples to apples. We can't do that. Each system is different. But we wanted to present this to you just so that you can have the background of in understand our logic for making some of these changes. So what you see here is that when you look across the board, you can see that the response time requirements in Monterey County, in some cases, are even more stringent than some of the other jurisdictions. For example, let's take a look at the urban, just the urban area. We have in a response time where Kern County, what they call urban, they have a 15-minute response time. For priority 2, we have a 10-minute response time. In Kern County is 15 minutes. And you can see that across the board without me pointing out every single priority and jurisdiction. So with the addition, not only do we add a response time compliance to the rural areas, but the maps were created with a very specific starting point of using calls per square mile. The response areas were then rationalized. This means that the response areas were smoothed out to some extent to prevent pockets of different response time areas within the larger area, What that means is that within the urban or suburban area, there may be very small pockets with higher population density or higher call density, I should say. But they are very minute area within the larger area. So it is not realistic to make that an urban area for just a very tiny dot on the map. So this process removed an area that would be considered rural from the middle of Salinas, for example, and it also moved an area in Greenfield from an urban designation to a suburban designation. It is not an easy process. I can tell you that. It is not an exact science. It is not an exact math. We're dealing with ranges. We work very closely with our GIS department in looking at this data for a period of years. One of the things that we have with the new RFP is that we are able to account for the continued growth in Monterey County. Section 5.4.14 of the draft agreement, actually the draft RFP, says that the EMS agency will review the call frequencies every 2 years. In response area boundaries may be shifted. So we are trying to draft an RFP, a new agreement that can adapt to changes in the future. So in addition, the new RFP allows more flexibility to the provider. We are emphasizing a commitment to personnel by encouraging the provider provide comfort stations, that they have a strong fatigue risk management and a stress management program. The RFP emphasizes programs that meet the specific needs of our community through culturally responsive and linguistically appropriate services. It also changed or eliminated requirements that added costs without sacrificing services. There were several accreditations that were required in the last RFP. We removed those. We are recommending it. We would like the provider to invest in that, but we're not making them required. We realize that there's a cost attached to doing that. We're also not requiring a new fleet, but we are requiring a vehicle replacement and maintenance plan and reporting requirements so that the agency can monitor the fleet. We also increased the amount that the EMS agency provides to the contractor for services provided by peripheral services providers. The amount that the agency distributes has not changed in the entire period of the contract. So it seemed reasonable that that amount be increased. And we also reduced the amount of liquidated damages. So I'm pointing those items out just so that you can see that in drafting this RFP, there had to be a give and take, you know, in an attempt to also pay attention to the feedback that was provided during the last RFP, that there were things on the one hand where we are being asked to be very innovative and creative, and then on the other hand, there are areas where, you know, it is difficult to make that change. So we are left with having to try to balance those two. So those are the comments that I have. And at this time, I'd just like to turn it over to the committee for discussion.
This is Tino from AMR. If I can add a couple of things, if you guys can hear me.
I can't hear you.
I'm sorry. Are you guys able to hear me?
Yep, we're able to hear you.
Okay, sorry about that. Yeah, looking at the RFP, and just one correction for the comments from Teresa is we measure our response times on a fractile response time standard, which is a more of a reliability for our response times rather than a 90 percentile. That ensures that we meet our compliance or our responses within 90% of the time of reliability. Comments on the RFP, again, where AMR supports the clinical excellence. We also support the response time reliabilities to all the areas. And of course, we're also looking at economic efficiency for everyone and customer satisfaction. And again, these points are definitely hard to attain at times, but for the most part, we look at being a high performance system, improving our operations to meet those demands. Of course, there's areas that are going to be very challenging for us, just for the mere fact that they're rural and hard to serve. But nonetheless, with some of our partners and fire, first responders, law enforcement, and hospitals, we continue to try to work to meet those demands. But again, a lot of good points, and we look forward to hearing more comments.
I appreciate the thought and the innovation that's gone into this RFP. I've made comments separately in writing, but I'm impressed with the level of effort that's gone into this, and I hope that the input from the community in general and the shareholders will be constructive as well.
Working still. Okay, I'm sorry. As representing the Monterey County Fire Chiefs, Advanced Life Support Providers, Teresa, thank you for, I think you identified looking at lessons learned from the last process, and we really appreciate that. We think the public outreach attempt was tremendous. Advertisement and all the print media was very helpful. I know there were some IT glitches that trying to submit comments, but we really appreciate the work of outreach, and I think it was noted by, I think, some of the public comments. Just the one thing that is what I'm concerned about is the information that the state gave the counties to go out to bid every 10 years, the 141 policy B. You know, they said you had to do that every 10 years, and that's what this body was told last year, right? With the county council's memo, and we know that's not to be true anymore. We know the courts just ruled that that 141 memo and that information was sent to county council, is that it has to be done in periodic intervals, and some counties have said that's 15 years to go out to bid. My only fear is going out to bid during a pandemic or on the tail end of a pandemic, if we can ever get this issue fixed. Ambulance companies are struggling with the reduction of transports and, of course, their PPE costs and all the other associated things. So what happens when you're a for-profit company and you go out to bid, that's all the companies that will come bid on this. Obviously, it's going to be at a higher price because they do not want to subsidize government. They're for-profit. And so I would just caution that I think the county procurement really needs to look at what their policy is, and if they're following state guidelines that have just been ruled illegal, then I would say it's probably up to the County Board of Supervisors to work with procurement to say what is periodic in their mind. Just because as a fire chief that runs an ambulance company and we saw a 30% reduction of transports, guess what? Our associated costs aren't going down, employees and workers' comp and insurance. So that's one thing. The second thing is liquidated damages. I think that is an extremely outdated mechanism for holding private ambulance companies for profit accountable, because what they do is they're for profit. So they build into their base rate all the fines. So guess what? The consumer pays that. But then that money does not go back to help the consumer. It goes into someone's budget as a government. I would rather see a fine mechanism that reduces the length of contract. It's not financially punitive. When you charge all those fines, you know who bears it? The employees, right? In the equipment they get and the salary and benefits they get. And when the cost of living in Monterey County is through the roof, trying to keep EMS employees, I would just caution that. Solano County, just when they went out to bid, and they stopped their bid process, right? Because when the state changed their bidding practice, they determined that there is no patient care outcomes that can be connected to liquidated damages. And so I would really look at that as a mechanism is it's a 10-year contract, and for every month you're out of compliance or whatever, you're reducing your contract by that much. So it's the carrot and the stick. Is we knew we were the highest rate 12 years ago when we went out to bid in California. We know we're not that anymore. Other areas are much more expensive. But I can tell you, when we just went out to bid in 2019, right, I think that was a $10,000 base rate, you'll see a reduction because of the great work you folks have done to try to reduce some of those costs. I guarantee it's going to be considerably much higher than what we have today. And that's just the nature of the cost of doing business in EMS and our payer mix. So I would just, as a comment, that hopefully, Teresa, you can work with the Health Department and the Board of Supervisors to understand once you go down that road and that numbers come in, that that's what we're going to have to tell the community. And it's very predictable that those numbers are going to rise substantially, regardless of all the great work we've done to try to value engineer it. It's just the nature of when you're not making money, you got to charge more. So thank you.
I have a comment, or actually a few comments. Jim Langford representing BLS Fire, and like to mirror what Chief Urquidez stated with thanking the EMSA with the changes that they've made in the RFP. Our city and the Fire Chiefs Association has and will be submitting their comments, and I won't go through all of those, but I just want to touch on a few that I think are important, and I think are important for this body to keep in mind as we move forward with the RFP. The first one is, and I thank you for explaining the response times, that was good, and then you and I had also had a conversation about the response times and how those were figured out. I would encourage you in the final creation of the RFP to explain in a little more detail some of the information regarding how response times, and I would even expand that into other areas, in particular when we're talking about exclusive operating area, and that in your intent is to not disallow mutual and automatic aid agreements, but I didn't see those things specifically in there. So I would encourage you to look at the comments and then ensure that the language in the RFP, if they actually are intended to meet a lot of these things in the comments, ensure that it's stated in there so that the bidders understand that. And one of the reasons why I say that is because, you know, they're competing for this contract, and if they know specifically what is required of them, and they have a better understanding when they put their bid together, obviously they're going to do it in a fashion that not only meets their needs but makes them more competitive. And so by having specific things in there, then you encourage them to possibly bring more to the table. And then that leads into my final point, is that in the RFP there's quite a bit of discussion about partnering with the health department, and off the top of my head I think there might have been another, possibly local hospitals. I don't remember exactly what that was, but I would encourage the EMSA to include expanding who you can partner with, and that ties in exactly into, you know, some of the challenges with the diversity, with the response times in our county, ties in with the ability to have equity, and also ties in with some of the specific language that ensuring that the contract or the bidders know that these things are available to them, so that again they can, from a value added standpoint, they can add that into their bid. So I guess I'll just kind of summarize it by saying that from a BLS fire department representative who's primarily our agency agencies are located in the rural areas. They're going to be either the suburban or the rural areas. We are the ones that will deal with the longer response times. And we also realize that a private contractor is going to look at things from a business perspective and make operational decisions based off of that. And sometimes those things are not equitable. So by having the ability to have partnerships and by specifically stating things clearly in the RFP, I think that enables them to put together more competitive bids that will meet the needs of all the areas within the county. Thank you.
I might comment. I'd like to build a little bit on what the chief said. I think there's a parallel here. Teresa, in the existing contract, there's a very brief section that talks to underserviced areas. Basically, it says there'll be no underserviced areas within the contract, and I think we need some coverage in there. That has I think the most applicability in our rural areas and perhaps even in some of our suburban areas has been demonstrated in performance over the last few years. So we need something in there that addresses that we will not have underserviced areas. Additionally, I'll add one more point here. You talked about the closest ambulance provisions. I think that needs to be very clear in the RFP and if necessary, amplified. I don't want to get us into a situation like we had at the crossroads in the past. We need to make absolutely sure that our language within the RFP and eventually in the contract specify most clearly that the closest ambulance is going to apply.
Any other comment from the committee members? Okay, so we can, as long as no one's opposed, we can go ahead and open up to public comment. As in the past, we'll limit public comment to 3 minutes per speaker. We decided to start with the people in the committee chamber.
Hi, Sam Ballesteri. My concern is with section 5.10.2.3, number 2. Mutual aid limited to 3% total call volume for reporting period. Limiting mutual aid will cost lives. It should be set at a higher level, maybe 5 or 6%, because we normally don't get that high. And the same section number 4, $500 fine is excessive for the 3% level. And my last comment is Exhibit J, MPDS response matrix. Response level Echo and Delta call for closest ALS ambulance and first responder. This means mutual aid calls can easily go over 3% in the reporting period.
Hi, everybody. Eric Hallwelling, Monterey County Regional Fire. I'd like to comment on section 2.2.8.5. This is in reference to the assess, treat, and refer provision of the RFP. And I'll just briefly quote the text. In this RFP, bidders may propose rates for certain non-transport services, including ALS treatment without transport and on-scene treatment and referral. My comment is for those areas of our fire district outside of the ambulance transport footprint, the community is already bearing the cost of ALS first response. And I don't feel it's fair that taxpayers should be subjected to an additional treatment without transport fee from the contractor. Essentially, they would be paying twice for not only services that are provided by the first responder, but kind of by extension, in many cases, there's also the closest ambulance would be within the fire district. So I'll close with that.
So I can't tell. Are there any other, anybody else who wants to comment within the committee chamber?
There's a comment from Harold.
Yes, if I may. Working on the Contract Compliance Committee, I want to appreciate, let you know that the South County of the suburban areas, putting those two together is a lot of good work. The times are reasonable, and it is a dramatic change from what we've done before. So I think it's based on science, and I think that's good. Second comment, and the last one, is that the map for the response areas, you need to consider down around Cologne Road. There's a lot of residents, there's a few residents down there that are on county property. They're county residents, they're not on federal land. So I don't believe there's any requirement for the Hunter Liggett ambulance to cover them. Now, I know they do, but if there's no requirement for them to do them, we don't know what the feds are going to do in the future. So probably we want to include those into the response area required into the contract. That's my comment.
Endo, Doc, do you have a comment?
Looks like he's muted.
So you're currently muted. You need to unmute yourself for a comment. So for Endo, Doc, you're currently muted. If you can unmute yourself for comment.
Maybe someone from IT or the meeting facilitator can unmute for him.
Endo Doc 81, can you unmute yourself so you can make your comment?
Maybe we can move on to the next comment and come back.
We don't have any more public comment via Zoom or calling.
Point of order. I'm getting I'm getting some text. People are saying that they can't log on, I guess, unless there's a link or something. So I think there's just people that are like, we want to talk, but we can't.
If it's appropriate, this is Eric again from Regional Fire. If I could make an additional comment while we're working out the technical bugs, just let me know if that's acceptable.
Sure, go ahead.
Okay, just a few comments about the portions of the RFP that deal with communication. First one is interoperable communication system, and that's 5.2.7. Contractor shall install and maintain an automatic vehicle locator devices on all its ambulances used within the Monterey County EMS system. I fully support the use of AVLs, but they've been used inconsistently in the past. So my question is, does this also mean that AVLs will be used by all transport providers in order to achieve the stated goal of closest ambulance response and not just the contract ambulance provider? Second comment has to do with EMS Communication Center redundancy. The RFP states the contractor shall develop the capability for backup or redundant EMS Communication Center. And my question is, the County 911 Communication Center does not have redundancy. So why are we asking the contractor to bear this cost?
We have somebody via Zoom. Sean Edwards, are you ready for comment? Doesn't look like he's moved.
Okay, can you hear me?
Yes.
Okay, thank you. Sorry about that. Yeah, Sean Edwards. I'm representing professional firefighters of CAL FIRE Local 2081, roughly 300 professional firefighters. Also, the International Association of Firefighters, all affiliated professional firefighters in the county submitted public comment. Thank you to the EMS agency for bringing this thoughtful revised RFP to the table. We do appreciate your time with that. First off, I'd like to just discuss the response times. Now, in comparison to the RFP draft out of 2019, there is a significant better response time criteria. But as far as the current contract that we have, the current contract, most, and I understand it was the previous, map zones, yellow, orange, and red. The current response times that we have in comparison to the now proposed, it's not, generally all that better. On the peninsula, there was some green areas for priority 1, 8-minute response time that now are going to be a 13-minute response time for that same priority 1. Generally, though, the North County area, we do appreciate the response times decreased from the last RFP 2019, and it seems to be improving. But I think a lot of people, and from what folks that we've been talking to, is they say, the times are a lot better. Well, in comparison to the 2019 response boundary times, they were, but not generally speaking. And so we are still concerned about those suburban and rural areas, and we appreciate the foresight that the county EMSA is still putting into that. With the, one second, please. Billing for possible treatment rendered without transport. We're solely against because we've seen this happen as far as the perspective of the first responder. When you have people that know that they're going to potentially be billed without transport, first, we believe that people are going to be not wanting to call 911 so readily when maybe it's needed, but also the folks in the field are the ones that deal with those ramifications a lot. They don't realize there's a difference between ambulance company, first responder. We just show up and say, oh yeah, last time you guys came, you didn't transport me, but I still got a bill in the mail. So the general public, what we deal with is that there's no dissociation between ambulance provider, first responder. We show up. And so that's why one of the reasons why that is in our comment, because we were solely going to be against that, any additional cost besides the CSA 74 that's been created to allow first responder equipment to be provided. So the parcels are already getting taxed within the county, and then to add a tax or a fee on that with treatment without transport, we're solely against that. And just to echo our comments as well, the mutual aid, we believe that existing mutual aid is for the betterment of the people. One thing I liked about our comments that we provided is it is a betterment for the people, the citizens of Monterey, not necessarily affecting our care that we provide. We want to provide the best care for the citizens of Monterey County. So we want to keep existing mutual aid contracts, closest available resource, respond, using the AVLs as applicable. And that's going to be all for my public comment. Thank you very much for my time.
Caller with your phone number ending in 837.
I'm not sure I'm unmuted. Can you guys hear me?
We can hear you.
All right, Warren Poitras. I'm with Monterey County Regional. I just want to point out the difficulty people have been having to make comments and get them through to the county. It's proven to be the true today. I was not at all sure that I was through to you guys, and usually it's been my experience it's *6. I see it says *9, which I tried. Anyway, it's working now, but I'm also watching this on Zoom, and I don't see my image, and perhaps I'm no techie, so maybe I'm doing something wrong. But I know I've had difficulty trying to get my written comments through to the county. I tried all weekend last weekend, and I know 2 weeks earlier than that, the county was notified that there was a problem with the system. And I just think it's important that you consider when you're going through this RFP, you may not be getting all the comments people would like to make because it's been so difficult to get through. And the rest of my comments are in writing and are printed already, so I'll leave it at that. But communication is valuable here and important, and it should be as smooth and easy as possible. And you might even want to consider extending another week the period of time where people can comment, because the system has apparently had so many glitches. Thank you.
If I may provide some clarification, the website shows the contact information for Gina Encallado, who is our contracts purchasing buyer assigned to this project. Her email address and physical address are both listed on the website. The form, it was not a required form. We have received a public comment in many different formats, from a memo to a table in Word to just an email directly to Gina. So the format is not a requirement. You can, as long as you can print it and mail it directly to Gina, or just send her an email, that information is on our website. EndoDoc, can you unmute your phone so you can make your comment?
Yes, I believe I'm unmuted now.
We can hear you.
Thank you. I just had to learn how to use the space bar to unmute. This is Dr. James Rawson. I'm a 22-year permanent resident of Carmel Highlands. I'm also on the Carmel Highlands Fire Board. Happy to hear Mr. Robbins talk about the situation of ambulance service in the area of Crossroads, and listening to the comments about the 3% of limitation of cooperating fees for adjacent ambulance services. I'm 77 years old. On my 2 streets where there are 20 houses, there are 8 people older than me. We figure we'll have 1 good ambulance ride, so we want to make sure that we're taken care of for all of our residents. We're certainly contracted with CAL FIRE and professional staff, and they've made many comments, and we certainly trust them to watch and make sure that this contract is done properly, and we'll rely on them for most of the details and comments that I believe have already been made by our chief. But we want to support specifically the president closest ambulance to us, which at this point is the City of Carmel Ambulance Service and Carmel Regional, as well as the county contract and new RFP that will be made. Just one comment that I had on the length of the contract. Having watched the procedures going on in the Bay Area, there was one 10-year contract that came up for renewal, went to the Board of Supervisors. I believe it was Contra Costa or Alameda County. And the supervisors recommended a change that be a 5-year contract with a 5-year option because of certain circumstances that can change during that time. And we've certainly seen circumstances change, as been reported today by the new virus and COVID-19. Thank you very much. I appreciate everybody's very hard work all the time, especially now. Thank you.
It appears that that's the end of public comment.
Okay. Well, we certainly appreciate the chance to have comment. I'm glad that everybody got to speak their mind. So we'll move on with the agenda then. Going on to item number 8 is future EMCC agenda items.
Dr. Roberts, is there going to be any discussion on that before we move into the next agenda item by the EMCC?
Discussion about the discussion about the RFP?
Yes.
I was under the impression that the committee and EMS agency were not going to respond today. This was more of a listening session.
Okay. But I guess then maybe I have another comment, and it was basically, I appreciate the fact that we've allowed for comment, and we've opened it up, and we're being very transparent, but I'm just curious as to what happens to these comments, how are they processed, and I guess from a transparency standpoint, how will the public and committee members know things that have been considered and or modified?
This is Susan Blitch from County Counsel's office. Generally speaking, the EMS Director will take all the public comments, incorporate or make changes as she deems necessary or prudent. The next step would be then to submit the RFP to the state for approval. Assuming the state approves the RFP, then it will be released for bids.
Okay, that's fine. I guess I'm just trying to avoid future misunderstandings, and that is I would encourage the EMSA Director to come up with some type of, I don't know, a response, a memo or something like that, acknowledging some of the changes or suggestions that or improvements that were put into the RFP. And I'm stating that from the standpoint of in allowing you to make sure that this is not something that just appears, oh, well, you gave us your comments and that's it, and now they've just forgotten about them. It's more of like, and I'm not trying to create more work for you, but trying to give you the opportunity to ensure that you're showing the public and the stakeholders that, yes, we did hear what you had to say, and or the good things, this is where they were incorporated. I don't know if that made sense, but thank you.
Okay. So with that understanding, then, are there any more comments?
It doesn't look like there are any more comments.
Okay, thanks. So then we'll move on to future EMCC agenda items. I'm sorry?
Chair McRoberts, it's Michael Urquidez representing Advanced Life Support Fire. I'd be curious to know, since we're 12 years into, I think we'll be a total of 12 years into AMR's contract with their initial contract when WestMed departed, and then the extension that we've recently had, I'm just curious of how much liquidated damages they've paid the county over that 12-year period, and what were those funds utilized for, considering that taxpayers pay the county about $1.8 million in CSA 74 funds annually for EMS, and I think we're sitting on about $3.5 million in reserves of CSA 74. Where do liquidated damages go, and how much have we accumulated during that 12-year period? Thank you.
Chair, I would support a definition of those costs, if you will, in a future meeting.
So maybe we can add that into one of the reports for the September meeting. Teresa or Susan, would that be possible?
You, as the chair, you certainly can set that for the next agenda.
Okay. Well, let's go ahead and ask for a report. Well, do we need to make a motion, Susan?
The chair has discretion to add it to the agenda.
Okay. Well, maybe we'll ask for an item under new business for the next meeting for a report. Anybody else have any other new business items? Or future EMCC agenda items, I'm sorry. Okay, and any other announcements or further go to the order?
I have one item for the good of the order. We have several people who will be leaving the EMCC, including yourself, Sean, and Harold. And I appreciate their service. I think we all owe them a commendation for their efforts. And I'd like to welcome the new folks on board, those who are just appointed and those who are going to be coming on board. The productivity of this body has been sustained over a very difficult period of time with the contracts and now with the COVID situation. And I for one appreciate that very much.
I have a quick comment. In the past, we had discussed bringing the Office of Emergency Management, that position, possibly making it a voting position where currently it is not. So I know we've had some discussion, but it's just kind of floundered there. So I don't know if it's an old business agenda item that needs to be discussed, or if I've just forgotten where we were at on that. But I'd like to bring that back up and so that if there is something that this body needs to do to enable that position to have a vote, we can make that decision.
Yeah, overall committee membership is something that has been in the works for discussion. We elected to skip a couple of the older items that were in process in order to allow more time for the RFP. So hopefully we can get back to that in the next meeting. Okay.
I just have a comment, Chair McRoberts.
Please, yeah.
I'd just like to say again, thank you for your time on the EMCC and for Harold Walgamon as well. I know Harold's been involved with EMS in Monterey County for, I don't know, Harold, I didn't want to throw you under the bus, but 40-something years. And I know he's been instrumental in South County as a voice during this ambulance RFP for at least 3 or 4 bids. So Harold, best wishes, and thank you for your service.
Okay, so with that, the next meeting is going to be Wednesday, September 9th, and we will go ahead and adjourn. Thank you, everybody.